Hello everyone, my name is Dr. Shashikiran. I'm a surgical gastroenterologist with 5 years experience in the field, and I have been working with Medfin from past 2 years. So coming to the symptoms of gastroesophageal reflux disease, the most common symptom will be heartburn. So as we've already discussed about, acid which is produced in the stomach is refluxing into the esophagus. So whenever there is acid in the esophagus, so we get that sensation which is known as heartburn. So there is retrosternal burning sensation. So that is the classical presentation with which patients present to us. And as the pathophysiology implied, the contents of the stomach are coming out. So there is regurgitation of food that we have ingested. So regurgitation is the second most common symptom. Also, whenever there is acid reflux, so when the acid reflux is severe, we get what is known as extra-esophageal symptoms. So apart from the esophagus, even the other organs might also get affected. So whenever there is acid reflux, so we have the breathing apparatus consisting of larynx and trachea in the just anterior to the esophagus. So the acid is refluxing into these structures also. So hoarseness of voice is a possibility because the larynx gets affected. And if there is aspiration of the food contents, because there is regurgitation of food, so there can be aspiration of the food content. So whenever there is aspiration, patients can present with repeated pneumonia. So also patients can have exacerbations of asthma, that is breathing difficulty, because there is aspiration of the acid and the food contents into the respiratory system also. And sometimes because of that acid reflux, patient will have that sour taste in the mouth. Also when the acid is refluxing into the mouth, there could be some tooth enamel destruction because acid is coming in direct contact with the tooth. So these are all some of the late features which the patients present. However, the most common symptoms are heartburn and regurgitation of the food that was just ingested. Coming to the diagnosis part of the gastroesophageal reflux disease. So one, the patient gives you a classical history. On examination part, most of the times there is nothing that can be picked up on the clinical examination part. Then the most common investigation that is done is endoscopy. So what is endoscopy? We put in an endoscope through the mouth to examine the esophagus, that is the food pipe, the esophagogastric junction and the stomach. So whenever there is acid that is coming out of stomach to the food pipe, that is the esophagus, there will be ulceration in the esophagus, because obviously whenever there is acid comes in contact with the delicate esophageal surface, so there will be multiple ulcerations. So that can be appreciated in endoscope. So once this is appreciated, there are other specific investigations like what is known as 24-hour pH metry. So what do is we measure the amount of acid that is refluxing from the stomach into the esophagus over a duration of 24 hours. So that gives us a definitive diagnosis that this amount of acid is refluxing from the stomach into the esophagus. So we have a cutoff there. So if that cutoff is exceeded, then we can make a diagnosis with surety that patient is having gastroesophageal reflux disease.